Good morning. Please come on in. Come on in. Please sit down. Good. It's good to see you. Fist pump. Yeah. Your name? Good. I am Dr. Andrew Michaels, and I am here to help you. So pleased to meet you. I hope we have a very good session. I'm going to get right to the sample taking for you. But I was looking at your file, and there are a few questions I have. So before we get started, I just wanted to make a call to your physician so that I make sure I get the right survey sample, the right areas. Yeah, I don't want to miss anything. Do you mind if I call him real quickly? Okay. All right, just only take a minute. And then I wanted to do it with you here in case there was any problems. Yes. Good morning, doctor. Yes, this is Dr. Andrew Michaels. Glad I got you here. Yes, I have them right here. They're in my office right now for their consultation and the sample survey. So you just need some hair, both sides, skin. Okay. All right, inside the swabs. Okay. All right. Oh, and inside the ears. Okay, not a problem. All right. Is that going to be all right with you? So we're going to take some hair samples from both sides of your scalp. We're going to take skin samples on both sides of your face. Mouth swabs, nose swabs, and ear swabs. Is that going to be all right? Okay, they agree. All right, well, there was just, yeah, they seem very, yeah. The impression I'm getting is they're very willing to see this through and get it done. That's so, yes. They're very troubled. I want to make this as painless as possible. Okay, when I get that done, I will have it sent, FedEx right away. Okay. If you want, you can send your assistant over to my office and pick them up directly. Okay. Yeah, we'll do the survey here, but you're more than welcome to pick up the samples yourself and do your own biopsy on it. Yeah, not a problem. That's okay with you too, right? They're totally in agreement. I think we have a very willing patient. Yeah. All right. Well, thank you so much, doctor. Okay, I will call you later. I should have some preliminary results this afternoon. I'll let you know. And we'll email the patient as well. Okay. Yeah, not a problem. Okay, talk to you soon. All right, thank you. Bye-bye. Okay. Yeah, I can email you the results that we get today. So, pretty simple, straightforward. So I get some surgical gloves on. There will be no cutting, just a little bit of scraping. Tissue scrapes, they don't hurt. And I use these specialty scissors, and you'll love them. They're so cool. I think you'll really like them to do the... Okay. The first thing I'd like to do, if you want to sit a little closer, I'd like to just get your heart rate real quick. Just for myself to make sure you're not under duress or stress. So just breathe normal. Okay. Good. Just want to make sure you're not under any kind of duress. So just breathe normal. Get this on your chest. Get it off your chest, more or less. You sound great. How do you feel? Okay. The next thing I'd like to do is just a really quick, just feel on your face. If you just don't mind. Basically all I'm doing here is just sure. You're gonna be all right. Real quick, I want to use this magnifying glass. You know, you can never find anything when you need it. You know how that is? Just want to look quickly into your eyes. Would you mind looking right at me? Look right at me. Right here. Follow the pen. Good. Just with your eyes. That's right. Same thing over here. Okay. And real quickly, just want to look one more time into your eyes. Okay. Very good. Okay. Real quick, can you just tell me how many fingers I'm holding up? I don't go quick. Very good. Okay. Puff out your cheeks like that. Good. And push on your eyebrows. Push on your eyelids. Good. Turn your head that way. Turn your head that way. Okay. You look great. Okay. You're doing great. Okay, I think we're ready. Do you feel nice and uncomfortable now that I've groped and touched you all over? And it's all part of the process. Basically making sure that you're okay. Just want to take this. I put my pen away. Pen light. Okay, real quick, I just want to check your... I just want to check your eye there real quick. Yeah, that's really kind of what I was looking for. Your skin does look like we're going to have to get that looked at, but I am not sure what the doctor is seeing is the same thing I'm seeing. So that might be good news, but like, we can't make diagnoses over the phone, and we certainly can't take diagnosis just off of visuals, so we have to be very careful how we do this. Now, what I would like to do is just very gingerly do a skin scraping on this side of your face. So, I want to get in there and just like that. And I want to put that in this dish, collection dish, and then I want to take another sample. Yes, go ahead. Keep giving me the dishes. And put it in a new dish. Please just keep switching them out. And my assistant helping me. Hope you don't mind. So we're gonna get this one right here on your forehead. Okay, put it in that dish. Whenever I do skin surveys like this, I always start to get itchy. My face, my nose. Isn't that weird? So if you feel the need to itch your face or scratch, don't feel bad. We're going to get one over here. Put that in this dish right here. Okay, and then one on this side. Good job. Let's keep switching them out. And we're going to get the one down lower here. Good, that's great. Okay, now that's the skin. Now these are going to be a little tougher. I don't want to forget, we're going to take a swab. We're going to stick it in the different orifices of your body. And we're going to get a sample of the tissue and the mucus and everything. Okay. So first we're going to start with your left nostril. Just get it up in there. Okay. Put it in the holder right here. Receptacle. Get another swab. We're going to do the right nostril. And we're going to put that swab away. Good. All right. We're going to get a new swab, and we're going to do the mouth. We're going to do the mouth twice. Okay? So, first side. Putting these away for me. Make sure you label them all correctly. You're being very good. I appreciate that. I know it's a little intrusive. Okay, this one's in the mouth. Just get it in there nice. No big deal. And that's the mouth. Now, we're going to get a new swab. And we're going to do your ear. So we're going to do your left ear first. Sorry. All right, and we're going to get that. That's the left ear. Make sure you label it. It has to be right. And then we're going to do the right ear. So let's get in there and get it in there. Not too much, just a little something. And then we just put that away. Okay. Good. Now, we have gotten the nose, the mouth, and the ears. Now we have gotten the skin, scrapings. So now we are going to, I like that right here. Ooh. Do you like that? Ooh. One is soft and one is scary, but they don't hurt, do they? Now we're going to do some hair. Okay. Now we're going to get some long hair samples off the very edge of the length of your hair at the outside edge. And then we're going to use these scissors, which are very strange, and I'm going to explain them to you, to get samples off of your scalp. Okay, so we're just going to use this little collection dish here. And we have it handy here, and just do a little snip. Scissors. I have big fingers, so. And then just get them right in that dish. And then we're going to do the same thing on the other side. It's a little tiny bit. And just to be safe, I'm going to get a couple more. And then a couple more over here. Good. And we want to wrap those up. There's the one sample set. And the second sample set. They're both basically the same. Got them off of each side of the head. Okay. Same length anyway. Now these scissors are very odd. I need to show them to you. Okay. Now these scissors are a little dainty and a little scary. They're old, but they're very sterile. They don't look it, but they're very clean. Now what this is a little flap. And a little sawed off little blade. See how the blade is sawed off? There's this little plate and there's this little catch basin. Now what these scissors are for is when you take a little snip of your short hairs there around the different parts of your head, the hair gets collected in here, in this container, so we don't lose it. So we're going to take a little snips. Just gonna do this side really well. Just want to get in there and get it all. And then we're going to secure those samples. You just gotta turn it over and collect them. Here you go. Take that sample. Very good. I have the best assistants, don't I? Okay. I have the best patience too. I know it's scary looking, but it looks a little medieval, but they used to make these to sniff out candles. Did you know that? You take your candle and you put the wick in there and it would snip it, and the fire and the hot ember would be caught in here where it would sniff it out safely. You could trim your candles. It's very similar technology. Very strange pair of scissors. That's how you get these strange little samples like that. I like this. Ooh. Very scary looking. Don't worry. So we're going to go over here and get samples on this side now. There you go. You're doing great. Just little tiny snips. Very close to the scalp. Little tiny snips. Yeah, you're doing great. Okay, then we just dump those out over here in the sample collection tray. And then that up. You're doing great. Good. Okay, I just need to clean my hands off real quick. Hang on, I just got to get a little bit of alcohol. Don't cross-contaminate. Don't want to cross-contaminate. Okay, just made a boo-boo. A little bit of alcohol goes a long way. Just sit that over there. There we go. And I'm just clean my hands off for a while. Okay, we've done very well. So let's see, let's review. We've done your nose, mouth, ears. We've done skin scrapings along the face, and we have done the hair samples, both the scalp real close and then the outer follicles. Okay, now I would just like to do some visual inspections, if you don't mind. Okay, let me get in there. I want to get you in just a little bit closer to me. There, just slide it a little bit. And we're just going to get in there and we just want to kind of look things over a little bit. I just want these for my records so I can do a proper referral for you. I want to be very thorough. You're doing great. You really are. Really happy that I got to spend some time with you today. How do you feel? Good. Good. Wonderful. I'm so glad you're doing well. Mm-hmm. Yeah, you're doing great. Good. No stitching. Just clean my hands and I'm touching my nose. I am the worst doctor. I know. I'm sorry. So, what can we do now that would be good for you? I can do that. I can definitely let your doctor know the results right away. They're running the tests right now. I want to ask you a few questions, if you don't mind, just for my own records. Yeah. Could you give me your age, just real quick? Okay. And date of birth. Probably should have asked you that before. Well, the problem is, I do believe that all this information on here is true. I don't think you have any reason to lie or deceive me. But you intrigue me as a longer-lived individual than you purport yourself to be in the data I have before me. And I'm wondering if there's something you want to discuss with me. Well, the reason I ask that is my name is Dr. Andrew Michaels, and I am an astrobiologist, not a medical doctor. No. And I'm not a cancer doctor. The reason your doctor sent you here was there was some anomalies in your paperwork that didn't match up with your biomedical scans or your patient history. Do you know why he sent you to an astrobiologist? Do you know what an astrobiologist is? Maybe we should start there. Well, an astrobiologist is somebody who studies life outside of the Earth. And I put your file down because I don't think the things you're about to talk to me about need to be written down in that file. But for your doctor and I to help you, we need you to help us understand where you came from. Now, are you of a terrestrial origin or an extraterrestrial origin? I know that's similar to asking your sexuality on Earth or your gender. Might be a little rude to ask that question to somebody. Are you this or are you that? You won't be outed here. That is not the purpose of this examination. The purpose of this examination is to help you. Get you the help you need, and you do need help, don't you? Yes. Okay. I know all about trust. I know all about trust. Right now, you have to take a trust me. And only tell me what you need to tell me. That's important to this case. Okay. It's all right. It's all right. Calm down. I'm not your average human being myself. I am wiser beyond my years and longer lived than I should have been allowed. But those are where the similarities between us stop. In this case, I am of terrestrial origin. And you are? That's right. You are not from this earth. Now, is that a polite way to say it? Okay. The rhythm of your heart, the electronic signals your body gives off, give you away. Now, we can give you a dampener, a device that changes your biometric scans to make you look human. So in the future, this won't happen again. So whether you believe at this moment in time of your discovery on Earth that you're safe, you are among friends here. You landed in the right place. I assure you, as a doctor and a scientist, and as a member of my government, that you're in safe hands here. I will also let you know that we have direct medical knowledge and protocols for your condition, and we can help you with it. It's not going to be a problem. Once we get the lab results back, once your doctor and I share this information only with each other, we have a protocol in line to help you. And we can get you healed right up and help you adjust to both our atmosphere and our climate here on Earth. Okay? You're not alone. Not anymore. Would you like to tell me why you are separated from your race and why you are on Earth? Just generalities. Basically, I'm asking, do you want to be discovered? Do you want to reconnect with your people? Or do you want to stay anonymous? Okay. That's right, you only have to tell me what you need to. I assure you. You have my word. I know that doesn't mean much, but I haven't done anything at this point to violate that trust. Okay, now, with all of that being said, I will, yeah, go ahead. No, I'm listening. With what you've told me, we will honor your privacy, and your doctor and I will keep your location and the knowledge of your existence here on Earth a secret. You can see us strictly on a medical level only, and we will not forward any of this information past the point that it needs to go, strictly for your medical care. Okay. Well, I'm glad we met, and I'm glad I was able to help you. You know, when I was your age, relatively speaking, I didn't get along so well with my family either. And they wanted a different life for me than maybe I wanted. So I can definitely understand where you're coming from. And I can also understand where you're going. And I don't want to interfere with that journey. So, that being said, yeah, I've been there. And your privacy does matter. So, good. Well, I'm going to let you go now. You can leave. We will have you go directly to your other doctor. We'll have the results pretty quick. And by the time you get there, he can start initiating the procedure, the protocol, and the treatment to get you fixed up. How's that sound? Good. Well, it was really nice meeting you. Ah, no problem. You're a good kid. On Earth, we call someone like you a good kid. And let's keep it that way. Let's let you take your journey where you need to go. All right? All right. Glad I could be a part. And I'm glad I could help you. That's why I am here. Not everybody's understanding, I know that. But some people are. So don't give up on us, the human race, just yet. All right. Okay, well, you take care, and I'll see you out, and I'll get these results to your doctor right away. All right, bye-bye. That was a really nice young person. I wish them well. I think they're going to do well in this world. Yeah, get all those samples out. And then I've got to go. I've got to make a couple phone calls to the doctor and verify everything they thought was correct. We got to lock down their office, make sure that he knows what can and cannot be shared. Okay? All right. Privacy is of the utmost. All right. I'll let you go then. And I'll let you go. And next time we talk will be very soon. Till then, have a most blessed day. Okay? All right. Bye-bye. Hello. Yes. This is Dr. Andrew Michaels. Oh, I know. You were right. You definitely made the right phone call. It's going to be all right. It's just a kid. It's just a kid. They're scared. They're alone. They're going through a lot of stuff right now. Could not be more alone in this world right now than... Yeah. All I want to say is our duty is to care. And, yeah. We definitely don't want to out this poor child. We just want to support them. Okay. Well, I'm glad you feel that way. You're a good doctor, and we will send somebody over there to help you with the protocol and the procedure. All right. Talk to you soon. All right. Bye-bye.